There, good evening. I'm Dr. Gordon. I'm going to be talking about ankle pain and injuries tonight. So let's get started here. So a little bit about my background. I did my medical school at SUNY Upstate in Syracuse, New York. Then did a residency in orthopedic surgery at SUNY Downstate, which is in Brooklyn. And then I did a sports medicine fellowship in Cincinnati, Ohio. And then I was in practice in Connecticut for a little while, and I've been here locally at Crystal Run for about 6 years. And I also have privileges here at Montefiore St. Luke's Cornwall Hospital. So just a brief legal thing. The information I'm going to give tonight is really for informational purposes only. It's not meant to help you treat, diagnose, or prevent any medical conditions. We're just going to broadly go through some different ankle conditions. Any questions you have should really be addressed to a qualified physician in the office. And I said nothing substitutes for formal medical evaluation. So ankle pain, a little bit of the overview. We're going to review some of the basic structures of the ankle. And we're going to go through some common conditions and injuries, and then the treatment options that are available for these conditions. So ankle anatomy and function, as you're probably aware, the ankle is a hinge joint. Basically, the foot moves up and down. There are 4 main bones in the ankle. So if you can see pointer here, so I'm trying to get it. So the main shin bone is called the tibia, which is here. The little bone on the outside of the leg is called the fibula, which is this one here. That's on the outer part. And I'm just going to point out these bumps of bone. So if you look at your own ankle, there's a bump on the outer part. This is called the lateral malleolus. And then this one over here on the inner part is called the medial malleolus. And then the talus is the bone here, which is the one that's actually part of the foot. And that's the one that actually does the motion, kind of the hinging back and forth. And then fourth one really is the heel bone, which is here. This is called the calcaneus. The primary function, as I said, is to be a hinge. However, particularly the joint between the calcaneus, the heel bone, and the talus can actually roll and can help provide some stability or balance on uneven ground. There are numerous tendons around the ankle. We won't go through all of them right now, but as we sort of discuss the conditions related to them, we can go through them. These are primarily help to stabilize the ankle. There's some also that help it move as well. And then the ligaments of the ankle. These are what we provide static stability to the ankle. They're basically just strings. As the ankle starts to move or roll in a particular direction, those will become taut, and eventually, if they go far enough, they can become sprain. The Achilles tendon, don't know where that is. That runs down the back of the leg. That is useful for power push-off and jumping. Some ankle conditions. So the most common one probably is an ankle sprain. We're all familiar with this. Most of us have had one of these at some point in our life. This is typically from an inversion type injury, meaning the ankle kind of rolls in like this. And when that happens, the ligaments on the outer part of the ankle here eventually, as I said, become taut and then get stretched out. They can partially tear as well. And then you get the familiar types of things. You get pain, you get swelling, and then usually down the line, you'll get bruising a few days later. It's very common when people get an ankle sprain to feel some kind of popping or snapping sensation in their ankle. Most people think this means they must have broken it. Usually, fortunately not. Treatment for ankle sprains is almost invariably without surgery. We do what's called a RICE protocol. RICE stands for rest, ice, compression, and elevation. NSAIDs, which are anti-inflammatory medications such as Advil or Aleve as needed, or Tylenol can be used for pain as well. And these will generally almost 99.999% of the time resolve on their own. Occasionally, if they become recurrent sprains or if there's any kind of residual instability in the ankle, these will require surgery, but that's really, really the exception. So the next condition we're going to talk about is a high ankle sprain. People who are into sports might hear this. It's very common in athletes. This is usually due to a twisting injury. This diagram is showing it here. Where basically the shin bone, the foot becomes fixed, the shin bone twists around. And this, as the name high ankle sprain involves the ligaments above the ankle. So it's these ligaments here that connect the fibula and the tibia. And then we grade these. Sometimes they're just a sprain. Sometimes there's actually more extensive tearing. And sometimes the tearing is so extensive that the bones will actually separate from one another. They may have an associated fracture. Sometimes the ligament will tear down here, and then the bone on the fibula will fracture up above. Sometimes also you can get ankle fractures associated with this. In the lower stage sprains, these usually take longer to resolve than your standard ankle sprain, but basically the treatment is like for an extended ankle sprain, at least in terms of duration, and then a boot or cast will sometimes be necessary. Some of these actually more commonly than a standard ankle sprain will need surgery. That is the ones where you get significant enough tearing for the bones to separate. So next on the spectrum is ankle fracture. So again, you can either have a rolling or twisting injury. When we look at ankle fractures, we're really classifying them as either stable or unstable fractures. So what does that mean? A stable fracture is one where enough of the supporting structures are intact, such that the relationship of all the bones in the ankle will basically remain fixed, and the talus, this bone here, will not shift, okay? And these, no surgery is needed. So this diagram here, or this picture here of an x-ray shows a stable ankle fracture of the fibula. This bone right here is broken, right there, hopefully you can see that. And as you can see, basically the normal structure of the ankle is maintained. So that will not need surgery. These are treated, again, in the same way an ankle sprain would be treated. Rest, ice, compression, elevation. You can put weight on these, you can walk on these. Sometimes a boot will be given really to help provide support for it to make it more comfortable while it's healing. Unstable ankle fractures, this is the second category here. Some of these are a little bit more subtle, such as this one here. So you can see there's subtle break there. But if you look here, as compared to this diagram up here, or this x-ray up here, the talus is shifted over and the space around it is not even. So in this case, it's clear that this ligament here is torn, the bone is shifted, and then there's a fracture here in the fibula as well. This will require surgery. Obviously, when your ankle looks like that, that is not good. You're not having a good day. That also will need surgery. It'll need to be properly aligned and held together so that it heals. The reason for that, or the reason that an unstable ankle fracture needs to be treated surgically, is that once the talus shifts over, even 2 millimeters, it increases the pressure on the cartilage here significantly, and it can lead to arthritis down the line. There's a risk of that anyway with any kind of ankle fracture, but that risk significantly increases if the alignment is not restored. Next condition we're going to talk about is peroneal tendonitis. So there's two main peroneal tendons on the outer part of your foot and ankle. And these come down, they hook around the bottom of the fibula. One of them attaches on the outer part of the foot, one of them attaches across underneath on the inner part of the foot. And these help provide stability to the ankle on uneven ground. And these are important also in ankle sprains. When your ankle starts to twist inwards, these are the ones that help try to right the ship, help try to stabilize the ankle and pull it back to even. So what you'll get with this is usually no injury that causes peroneal tendonitis. You can get pain with prolonged walking and difficulty walking on uneven ground. Initial treatment for this is ice and anti-inflammatory medications, physical therapy to help strengthen up those the muscles and the tendons there, and then possibly a walking boot to help protect these and eliminate the use for them, at least temporarily, such that they can the tendonitis, the inflammation can resolve. Surgery is rarely needed. Sometimes the tendons in this diagram, showing it here, get compressed by what's called the retinaculum. It's basically a ligament that helps hold the tendons against the bone. And occasionally, though, these will develop what's called a split tear, where the tendon gets irritated enough where it doesn't tear across the tendon, but it tears in line with the tendon. Those sometimes will require surgery. Next condition is Achilles tendonitis. So we all know the Achilles tendon is the tendon in the back of the leg here. And what happens is over time, with extra strain, the tendon fibers start to degrade. And any kind of tendon condition like this, because it happens slowly, the body doesn't have a really effective mechanism for dealing with it. When you have an acute injury, such as an ankle sprain, there's an effective pathway. You get the normal inflammation or inflammatory process, and the body devotes the resources necessary to heal it. With these slow processes, the healing process is very energy expensive. It sort of costs the body a lot to do it, and therefore it doesn't devote the resources. So the tendon fibers start to break down slowly over time. Microscopically, it's not something that you necessarily see from the outside. And what happens is, as you start to lose more and more of the tendon fibers, it puts more strain on the remaining healthy fibers, which then causes them to break down. So it kind of is a progressive condition. It's usually due, as I said, to repetitive strain in the area. People who have very tight calf muscles are a little bit more at risk for this, again, because it just puts more tension in the system. And we describe two types of Achilles tendonitis. There's insertional Achilles tendinopathy, which is where it attaches right on the Achilles, the heel bone here, and then there's mid-substance in the mid portion of the tendon. Initial treatment usually consists of, again, ice and anti-inflammatories, resting it with possible immobilization. Usually in a walking boot, sometimes it's really refractory. We'll even put people in a cast for a few weeks. And then physical therapy. So stretching is important. Again, I said tightness in the calf muscles and then the tendon can make this worse. And then a specific kind of strengthening called eccentric strengthening, where the muscle and the tendon are loaded but lengthened. So the pressure is put here, whereas the foot is actually coming up. We call dorsiflexion. So the tendon lengthens, but it's resisting the forces on it. Surgery is rarely needed for this. Sometimes, usually more in insertional Achilles tendonitis, you'll get this big bump of bone here, which sometimes you can actually even see from the outside. So that's taken off, the tendon is detached and reattached onto the bone. Obviously, that is a very lengthy recovery and a difficult recovery, so we try to avoid that if possible. Other treatments, such as platelet-rich protein, are less proven for this condition. So next is Achilles tendon ruptures. So Achilles tendon ruptures are caused from a sudden strong load in the tendon, usually happening again at the mid-substance. And the reason this area is vulnerable is that the blood supply is less in this mid-region over here. Sometimes they'll rupture off of the heel again. That's usually if there's some kind of underlying prior tendon issue that will happen. When we describe this, usually in the weekend warriors, I can safely say I'm in that mid-40 range, where people go out, they don't exercise too regularly, they decide they're going to play a pickup game of basketball or go out and play soccer, and they go to push off and they feel like they got kicked in the back of the leg or hit in the back of the leg, and they look around and there's absolutely no one behind them. And that's usually sort of the classic story when this happens. Two really modes of treatment. So you can either treat it surgically or non-surgically. So non-surgical treatment involves putting it in a series of casts to help bring the tendon edges together and then lengthen it back out to its proper length. There's actually the same rate of healing, whether it's treated surgically or non-surgically. However, there's a higher risk of re-rupture when it's treated non-surgically. So that's the value of treating it surgically. Obviously, the disadvantage is that there's risks of wound issues, there's the anesthetic risks, et cetera. So that's sort of the things we look at and try to balance when deciding how to treat this. Medical and surgical history are very important in this. There's more risk of wound issues or healing issues in people who are diabetics and smokers. Next condition is posterior tibial tendon dysfunction. I know that's kind of a long name. So the posterior tibial tendon is this tendon right here that runs down and attaches on the inner part of the foot. So this runs down, again, under the medial malleus here. Medial malleolus. This is important in stabilizing the arch of the foot. So as the tendon starts to become diseased, either inflamed or frankly, and sometimes it can actually rupture, start to see, if you look at someone from behind, that the foot takes this kind of position here. So this is another diagram of it. So this here, you can see this foot nice and straight. Can only see usually one, maybe two toes. And as the foot starts to roll inwards like this, you start to see 4 toes, 3 and 4 toes. You can kind of see that here. This is called a too many toes sign. One of the specific findings that we look for when we're examining this is that you're unable to go up on your tippy toes on that foot. So when the other foot is lifted, you're unable to go up because this, again, this is important to stabilize the arch. So if the arch is not stable, you're not able to go up on your tippy toes. People who have this develop a progressive flat foot deformity. So if you normally had a good arch and all of a sudden start to lose that arch, that might be a sign of this. There are other things obviously that can cause that as well. And there's a real spectrum of disease of this. So in the early stages, it's just inflammation in the tendon. It makes it difficult again to hold the foot in the normal position. It's really best to deal with this early. So if you start to notice this, start to notice pain on that part of the foot, you should get evaluated early. At late stages, or if you try to load this too much, it can rupture. And when it ruptures, there's a higher risk of arthritis in and around the foot. And then what happens is eventually is you get what's called a fixed flat foot deformity where the foot, the arch can't support itself. And it actually just collapses, and then there's enough arthritis and the bones get stiff enough that it can't be restored flexibly. And those actually require surgery to restore the arch. So next condition is ankle arthritis. So sort of a normal looking ankle up here. Okay, and this is an arthritic ankle. And what we see is that the joint space is narrowed down. You don't see the nice space that we can see here clearly across. The ankle becomes very painful and stiff. So as I say, usually this is from trauma, but other conditions that can cause this are rheumatoid arthritis and infections. Again, you get progressive pain and stiffness. Primarily, treatment is aimed at the symptoms of this condition. It is actually very difficult to treat ankle arthritis. As I said, there's limited options beyond symptom treatment, meaning ice, anti-inflammatories, occasionally cortisone injection. The limited options beyond are an ankle fusion, which we see here, where the two bones are basically fused together, so they don't move and therefore not painful. The downside of this is that means that every other joint around the ankle is taking more motion. Eventually, those will become arthritic down the line. The other option is an ankle replacement, which is shown here. Unfortunately, these really don't have very good longevity, so this is really a sort of a last-ditch option. Again, they don't have the longevity, so let's say like an ankle or knee replacement, so we don't do these as frequently. Next conditions are two related conditions called gout or pseudogout. So they're crystals that form within the joint, and they cause a rapid onset of pain and swelling. You can see that the ankle is red in here, very swollen. So gout is formed by what's called uric acid crystals, and pseudogout is another type of crystal called a calcium pyrophosphate crystal. And sometimes we actually do need to take the fluid out of the joint to diagnose. I put this picture in here. These are uric acid crystals. They're actually sort of pretty looking if you look at them. It's kind of an interesting thing. It could be like a modern art diagram there, but kind of these long, sharp crystals. And depending upon which way the light hits them, they either light up like red or blue, which is why you see those different colors there. The treatment basically in the immediate term is reduce pain and inflammation. So anti-inflammatory medications, icing, cortisone injections are sometimes helpful for this. And in the long term, the goal is to reduce crystal formation. So there are medications that can help do that. And then dietary changes, certain foods, such as seafood, alcohol, red meat, it's particularly for gout, can increase the likelihood of getting gout. And finally, other causes of, and I put in quotes, ankle pain. So a pinched nerve in the low back can cause pain that radiates down to the ankle. Sometimes can feel it in the heel. Nerve pain, other kinds of nerve pain where there's called peripheral neuropathy, where the nerves actually down the leg get affected. And finally, leg swelling. So you get fluid retention. And this is showing here something called pitting edema, which is where you push in on the leg and you can see that an indentation is left behind. There are many causes of this. Many of these require medical treatment. So it's good to actually get this checked out sooner rather than later if you notice your ankles start to look like that. Venous stasis, this is due to backup of blood in your veins. So the veins have valves, which are supposed to basically stop the blood from going backwards. Sometimes they don't work as well. And you get a buildup of blood, and it pours out into the tissues, or it builds up in the tissues, and it causes reddening of the skin, thickening of the skin. It can cause pain around the ankle. And finally, blood clots. So we call deep venous thrombosis or deep vein clots. These can cause pain in and around the ankle and the calf. These, if you have any suspicion that you have one of these, go get checked immediately. Go to the ER.